38 million. That's how many Californians are spending part of their lives serving as a caregiver for someone in their family. More people than in any other place in the entire country. It can be an overwhelming, depressing, isolating job in addition to whatever paid job those folks may have. This summer, Uber plans to do something new to help them help those that they love. With me now live, Andy Friedman, VP of Client Experience and Corporate Marketing at Assured Allies, which is working with Uber to get this project off the ground. Andy, good morning to you.
Hi, thanks for having me.
Definitely. If I'm one of the 1 in 4 American women or 1 in 5 American men who are managing the medical needs of someone in their family right now, why should I be interested in Uber Caregiver?
Yeah, so at our company, we work primarily with older adults and long-term care insurance policyholders, including CalPERS long-term care insurance policyholders, to identify solutions to help them stay at home. Often when we're working with an adult child or a caregiver, I am one of the 1 in 5 American men who is caring for my 99-year-old grandmother.
Wow.
Issues emerge around how to get the person in our life to a medical appointment, how to keep them safe and on time and reliable. And so being able to refer such a solution that is funded by Medicare Advantage in many cases is a great addition and something that we will certainly be sharing with the people we work with.
Most caregivers are still trying to work their paid jobs, as I mentioned, and handle the duties of what is really a full-time job on the side. You know about this because obviously you have a full-time job. And so if you have a person in your care and maybe they can handle being at home alone, but definitely shouldn't be driving, this could really be a game changer just in health for both the patient and the person looking after them, couldn't it? Because you're not going to miss an appointment necessarily because of a simple transportation issue.
Yeah, one of the biggest challenges with caregiving is ignoring the mental health of your own. And so being able to have a solution that allows you to kind of take on the responsibility of ensuring that you're helping support the medical needs of your loved one while still kind of maintaining your own mental health, caring for your own family if you have young children like I do, or your own job is really helpful and will create a lot of balance in being able to know that you're caring for the person you're responsible for, but also caring for yourself. So we're really excited to see this come to the market.
Since last Wednesday, families have been able to sign up to be notified when their insurance is added as an Uber caregiver partner. Customers 65 and older with Medicare Advantage, you mentioned that, Medicaid recipients, and then those with commercial insurance who their employers, they're going to be eligible. So this is really kind of getting at a wide swath of the population out there.
Absolutely. And so if you are interested in the solution, my suggestion is to check with your insurance company. If you have Medicare Advantage, give them a call and see if you're eligible to receive this benefit. If you have insurance through your employer, do the same. I imagine this will continue to be increasingly accessible to consumers across the country. So it's only a matter of time if your insurance company isn't providing it today.
And since we're talking about a population that is sort of by definition vulnerable, drivers who are going to be doing these rides for doctors, they're vetted, right? And then you can track during the trips?
Yeah, absolutely. So I have this concern even thinking about my own grandmother who for many years would only take a taxi with a single taxi driver. So knowing that you can offer the security, not just to know that the driver is vetted, but as someone who's requesting the ride, you can track the ride itself. So you know exactly when your care recipient is arriving at the appointment, you know how that experience, and you can follow up immediately after to kind of get some real-time feedback on how that went. So not only is it a vetted ride, but it's one that you can track on your phone while you're at your job or while you're caring for your family.
Wow. Well, using health benefits to pay for these rides, this is going to flow through the wallet in your Uber or Uber Eats app. And then eventually there's going to be an application for groceries and over-the-counter meds as well. Do you know yet, or can you tell us what insurers have signed on to this so far? And do we know if there's a specific date yet for launch? We've heard, coming this summer.
Yeah, I don't have specifics on the date of launch. I do know that, especially in the world of Medicare Advantage, these types of caregiver solutions have been increasing in popularity and acceptance. You mentioned not only is this about transportation, it's about meal and grocery delivery, it's about getting prescriptions filled. These are all tasks that can take a significant toll on a caregiver if you're having to run to multiple pharmacies and go pick up groceries or meals. Having solutions that deliver reliable, high-quality experiences to someone you love, those programs will increasingly be available to Americans across the country.
All righty. Well, we are going to be looking for the updates about when this gets started. Thank you so much for sharing what is coming down the pike for, once again, we said 38 million Californians who are actively doing this right now and trying to find those solutions and piece it all together and make it work with the young family that they may be